Welcome to our group project. We are Shakiri Garcia, Luan Thakur, Victoria Budu Singh, Chantal Bovel, and Gregory Nath. History of non-Hodgkin's lymphoma. As this diagram shows, the lymphatic system is highly pervasive throughout the human body. The vessels and structures in green form the lymphatic system, and we can see it is made of tissues and vessels and communicates with almost all regions of the human body. Now we can group the functions into three broad categories, which are fluid balance, protection, and the ability to absorb fats. However, its protective function is where the story of non-Hodgkin's lymphoma begins. So what is non-Hodgkin's lymphoma? Well, in the simplest terms, it is the unregulated multiplication of the lymphocytes, which makes it a type of cancer. And since lymph nodes are widespread in the body, NHL, which is non-Hodgkin's lymphoma, can begin virtually anywhere. The causes of non-Hodgkin's lymphoma. So what are the causes of non-Hodgkin's lymphoma? Well, we can see from this diagram that cancer cells may develop in the thymus, lymph nodes, bone marrow, or spleen. These are the most common areas. The diagram also identifies T-cell lymphocytes and B-cell lymphocytes. Types of non-Hodgkin's lymphoma. So T-cell lymphocytes function to destroy cells that are abnormal in the body, whereas B-cell lymphocytes function to produce antibodies that destroy bacteria and viruses. It is important to distinguish between NHL that starts in the B-cell lymphocytes and NHL that starts in the T-cell lymphocytes, since each type presents a different degree of risk to the patient, and therefore the treatment approaches also differ, as we shall see later on. So NHL associated with T-cell lymphocytes are slow growing and tend to present very little symptoms. NHL associated with B-cell lymphocytes, however, are fast growing, present severe symptoms, and spread very quickly. Symptoms of non-Hodgkin's lymphoma. Well, the most common symptoms are swollen lymph nodes in the neck, armpit, and groin, abdominal discomfort and swelling, persistent coughing, difficulty breathing, and chest pain, persistent fatigue, fever, night sweats, unexplained weight loss. Now, many of these symptoms are common to other conditions, so patients are advised to check for NHL only if these symptoms persist over a prolonged period of time. Pharmacological treatment for non-Hodgkin's lymphoma. Once diagnosed, fortunately, there are treatments available, pharmacological treatments being the most successful and most widely used. As mentioned earlier, the type of treatment depends on the category of NHL, but it also depends on the stage of the disease. Chemotherapy is used in later stages of NHL, and it involves medicine that is taken intravenously or orally, depending on the nature of the disease. With radiotherapy, the patient is exposed to radiation. This is used in early stages where the cancer has not been able to spread very far. The radiation destroys the cells, and many times this has been an effective treatment for eradicating all cancer cells in the early stages. Monoclonal antibody therapy involves medicines that attach to normal cells and instruct the immune system to attack the cancer cells. The normal cells are not damaged in this process and return to normal function after treatment. This also has been shown to be effective, and it is used mainly for B-cell aggressive NHL. If chemotherapy is unsuccessful, targeted drugs are used. There are many options available. Some prevent the nucleus from working, others affect cell growth, and some affect active genes. Surgical treatments are not very common for NHL. However, surgical procedures like biopsies are valuable for the purpose of testing for non-Hodgkin's lymphoma and figuring out the type and stage of non-Hodgkin's lymphoma that a patient may be exhibiting. There is a rare type of NHL called splenic marginal zone lymphoma. In this case, surgery can be performed to remove the spleen as a treatment option. Alternative treatments. Well, there are currently no alternative treatments that show clinical evidence of removing or reducing or improving NHL. However, patients can get significant relief from some of the unpleasant side effects of NHL treatments and also some of the unpleasant symptoms and signs that the disease itself presents. And these may include things like acupuncture and other stress-reducing activities. Summary of treatment options for non-Hodgkin's lymphoma. So to summarize the treatment options, we have pharmacological treatments, which are the most successful and most widely used. They include chemotherapy, radiotherapy, monoclonal antibody therapy, and targeted drugs. For testing purposes, we have surgical treatments. Testing purposes would include biopsies being done, and the only actual surgical procedure would be a splenectomy, where the spleen is removed in the case of marginal zone lymphoma. Alternative treatments are basically used for managing symptoms and stress relief and symptom relief. Prognosis for non-Hodgkin's lymphoma. So this table shows a 5-year survival rate for both T-cell and B-cell NHL. We can see that T-cell has a significantly better prognosis. This is mainly due to its less aggressive growth and the possibility of early detection. So in conclusion, non-Hodgkin's lymphoma is very serious with real life-threatening consequences. The best prognosis is achieved from early detection and correct categorization of NHL. And fortunately, research is vibrant in this field and global and ongoing. So new treatments are definitely on the horizon. These are the sources of information that we used for our presentation. And we would like to thank you for your time and hope that this was an interesting and informative presentation on non-Hodgkin's lymphoma. Thank you for watching. In the end.